Hello, my name is Gregory Glauser. I'm a fourth-year medical student from Temple University presenting data from the Penn Neurosurgery Department, Dr. Neil Malholtra's lab. The title of this project is The Relationship of Social Determinants of Health with Postoperative Neurosurgical Outcomes, an Epilogue Study. We have no financial disclosures. So just to introduce the topic, disparities in medical care lead to avoidable negative clinical outcomes. That can be disparities based on access to care, who's providing the care, or outcome of care once it's been established. The emphasis on looking at healthcare disparities has come really to the fore with the COVID-19 pandemic, as shown by a recent JAMA article that was published during this time. And this diagram on the right here is from a government publication showing disparities in survival of life expectancy in U.S. citizens who are grouped by race, and showing that their household income and percent of the poverty line directly impacts their survival. So this is kind of a driving force of our studies. So what is social determinants of health? So the World Health Organization defines that as the conditions in which people are born, grow, live, work, and age. So really just anything outside of the clinical setting that could impact their clinical care. So some social determinants that are commonly looked at are race, gender, and household income. What is the Epilogue tool? So Epilogue is a data input and acquisition tool created by the group at Penn. It's built into the electronic health record. It's a workflow and budget neutral way for augmenting communication, patient care, quality improvement, and research efforts. So kind of getting at the technology piece of this presentation. This tool was featured in the New Yorker in November of 2018. So methods for our studies, had a hypothesis, extracted data using the Epilogue tool, and we did exact matched analysis using coarse and exact matching. So similar to more standard matching approaches, but rather than propensity score where we score each variable and come up with a composite score, coarse and exact matching does one-to-one matching on each variable. So just another way of minimizing confounding in the data. So we looked at our first study was looking at race and how it impacted supratentorial brain tumor outcomes. So this is a retrospective exact matched analysis over a 6-year period. We had 1,700 patients. Our primary outcome was mortality, secondary outcomes of readmission, emergency room visits, and return to surgery. Those outcomes are consistent throughout all of the data that I'm going to present here today. We found no difference in 30-day outcomes, and we did find that in the extended follow-up period, African-American patients were twice as likely to be readmitted. However, there was no difference in any of the other measured outcomes. And of note, it was impossible to fully isolate race from household income in our population as they're too closely linked. So our primary outcome here was mortality. So what we found in our matched cohort was no significant difference in survival. However, we did note that there appeared to be a difference in the early postoperative window. So we did a sub-analysis that showed a statistically significant difference between survival of our African-American and Caucasian cohorts in the first postoperative year. And we hypothesized that is likely attributable to income differences between these racial cohorts, which we were not able to fully isolate out. So we followed up and did a subsequent study looking at household income exclusively and how it impacted supratentorial brain tumor outcomes. So in a retrospective regression and exact matched analysis over a 6-year period, we had 1,970 patients. What we found was in our regression pre-matched, there was a increasing survival at 30 and 90 days as we went up in our household income. And in addition, that finding held up in our matched comparison, looking at our highest income and lowest income quartile. So here's our entire population regression analysis, comparing our highest income quartile 4 and lowest income quartile 1 patients with a statistically significant difference in survival, which held up after we exact matched on baseline characteristics here, showing increased survival in our higher income patients. So as this finding seemed to be reproducible, we wanted to test both our race and income-based findings in other neurosurgical populations. So we looked at race and how it impacted pituitary tumor outcomes. So this is a study of 567 patients. And what we found here was that African-American patients were 4 times as likely to visit the ER postoperatively. However, there was no difference in the remaining outcomes that we studied. So showing here no significant difference in survival, just a difference in emergency room evaluations at 30 days. So circling back to just looking at household income exclusively, we analyzed this in posterior fossa tumor resection over a 6-year period and found that lower income correlated with increased mortality within 30 and 90 days postoperatively. And this is, again, a direct comparison of our highest income and lowest income quartile patients looking at exclusively survival in the postoperative period. And you see there's a significant difference here that has statistical significance. And some, again, held up with our secondary outcomes, increased reoperation with our lower income patients as well. And again, that held up when we looked at CPA tumor resection. So we found here that higher income correlated with a reduced risk of reoperation within 30 and 90 and extended days after surgery. And it also held up when we looked at supratentorial meningioma resection outcomes. We found that our lower income patients had an increased risk of being seen in the emergency department at 30 and 90 days postoperatively. So putting all these studies together, what we found was that household income appears to be the primary driver of postoperative outcomes, particularly mortality after neurosurgical procedures. In our race-based studies, we found that when we matched on all of our covariates, race doesn't appear to be as much of a driver as household income. And in that supratentorial tumor population, when we exclusively looked at the first year postoperative, isolating that out from the remaining extended postoperative window, we found that there was a statistically significant difference. However, in our population, we were not able to fully isolate household income and race from each other. So we hypothesized again that disease-related factors will likely surpass the impact of societal factors in the extended postoperative period, but in that first year, it does appear that household income is the driver of our mortality outcomes. And circling back to the epilogue tool and how technology kind of makes these initiatives possible, what we showed here is that epilogue can really, tools such as epilogue can really be the catalyst for outcome-based studies. And all of the data that was generated to use in the analyses that we described here were produced via epilogue in a pretty seamless fashion, just kind of extracting information from that's already present in the electronic health record. So just a way of really making use of the technology that's available today to drive outcome-based studies. And we'd like to thank you all for your time.